Hello everyone. Here we are going to discuss the important topic that is Hirschsprung disease. In your exam, you can get a question on Hirschsprung disease, its pathogenesis, especially clinical features, screening test, and the morphology. In the morphology, you have to write down the gross and the microscopy. So we will discuss everything about the Hirschsprung disease. Hirschsprung disease. First of all, I will let you know its introduction. What is Hirschsprung disease? Then we will see its gender prevalence, then incidence, site, pathogenesis, clinical features, screening test, and the morphology. So let's start the disease, Hirschsprung disease. What is Hirschsprung disease? Hirschsprung disease, also known as congenital aganglionic megacolon. I will explain why this terminology is given to Hirschsprung disease. It is a congenital disease. That's why, of course, it is known as congenital. Now, in this, a portion of the distal colon, can you see this portion? This portion of the distal colon, there is no ganglion in this portion. That's why this is a aganglionic portion. Because this portion, in this portion, there is arrested migration of the neural crest cells. So the neural crest cells which are in the embryonic life, which are migrating into the gut, this portion do not have those migration. So this portion don't have any ganglion. This portion of the colon, it is aganglionic portion. So that's why the colon, this portion of the colon is very narrowed. The lumen is very narrowed. So this is known as functional obstruction. This is the functionally obstructed colon. A portion of colon just above that is mega dilated. So that's why it is known as megacolon. The Hirschsprung segment is aganglionic, it is narrowed, but a portion above that is dilated because food is accumulating, because there is a narrowed lumen or functional obstruction ahead. That's why it is megacolon. So megacolon is the portion above the aganglionic portion. The aganglionic portion, it lacks the peristaltic contraction. That's why it's the functional obstruction. So that is Hirschsprung disease. Here also you can see this is the normal colon and the rectum. This is Hirschsprung disease. Now see. So see this portion of the colon normally. Normally in complete colon, you can see the yellow dots. That is the ganglions. So ganglions are present everywhere. Can you see the ganglions? They're present throughout the colon. But see in Hirschsprung disease, a portion of the distal colon don't have ganglion. It is a aganglionic segment. That's why there is no peristalsis. Since ganglion are absent, so there is no peristalsis. So there is functional obstruction in this portion. It's very narrowed, the lumen is very narrowed, so that the portion just above that get dilated, looking like megacolon. So this is Hirschsprung disease, in which a portion which is without ganglion is narrowed, and a portion just above that which is having the ganglion is dilated in response to the narrowed portion. So that is Hirschsprung disease. It is more common in males as compared to female, and the incidence is 1 in 5,000 live birth. Every 5,000, one live birth is Hirschsprung disease. Most commonly, it is affecting the rectum. As I told you, rectum is always affected. Proximal involvement is variable, but by default, rectum is always affected. Up to what length the rectum will go backward, the colon can be variable, but rectum is always affected. What is the pathogenesis? There is mutation in the red tyrosine kinase receptor. Due to the mutation in red tyrosine kinase receptor, there is arrested migration of the neural crest cells in the gut. The neural cell crest in the gut, they get arrested. So the affected segment in which the neural crest cells are not going, they are not migrating, in which the ganglions are absent. The Meissner plexus and Auerbach plexus, both the plexus are absent in the submucosa. So basically complete absence of the ganglion. So that portion of the colon is aganglionic. That portion of the colon is aganglionic. Can you see this portion? This portion lacks the ganglion. So there is no peristaltic activity, and it's very narrow. The lumen is very narrow. It is looking like a functional obstruction. So the portion of the colon which is just above that, it shows progressive dilatation and hypertrophy, the unaffected proximal colon, and this is Hirschsprung disease. So Hirschsprung disease have two things. The aganglionic portion is very narrow. Because there is no peristalsis, it's very narrow. It is having absence of ganglion, no Mantric plexus, no Auerbach plexus. Since it is very narrow, in response to that, the proximal portion get dilated. This is ganglionic portion. So this portion have the ganglion and it is dilated, and this portion is aganglionic. It don't have ganglion, it is narrowed. So this combination is known as Hirschsprung disease. I hope you got what is Hirschsprung disease. So main thing, there is arrested migration of neural crest cells into the gut, a portion of the gut. So that is the main thing. Now what are the clinical features? So it is congenital. It is presented in the neonate. Neonate is unable to pass the meconium. Neonate is unable to pass the meconium. There is severe abdominal distension. The neonate is unable to pass the meconium. There is severely distended megacolon. So portion of the colon which is severely